Welcome back. In Pennsylvania, giving birth can be deadly, especially if you're a Black woman. In our state, Black women are 3 times more likely to die from pregnancy-related complications than white women. But there are people working hard to lower the death rate, giving women and their children more access to care before, during, and after pregnancy. Joining me now is the CEO of Healthy Start, Jada Shirriel, and community health advocate Faith Otey. Welcome to you both. Thank you for joining us this afternoon. Jada, I wanted to first start with you and talk about the programs that Healthy Start do for people who don't know about it.
Absolutely. So Healthy Start has been serving Allegheny and surrounding counties since 1991. So that's almost 35 years of impact, serving moms, babies, fathers, and families. We're best known for our community-based in-home services, which include education assessment, connection to resources, whatever a family needs, getting down on the floor with mom and baby and supporting them and getting acclimated to parenthood. We have grown since 1991 to broaden our focus from direct and community services to systems change efforts that can help improve the lives of moms and babies. So we have a policy and advocacy team now, really understanding how policy impacts our everyday lives. We have a research team. And we do a lot of convening, bringing people together around issues that impact women's health, maternal child health, and public health generally.
Okay. And Faith, I want to hear from you. You have directly benefited from the work that Healthy Start does. Tell us a little bit about your situation and kind of where they came in at this hard period, I'm sure, in your life.
Yeah, I was in a not so healthy marriage, and when I had my first daughter, or my first child rather, I had enrolled in the program, and they were an unexpected village of support during that time, really helping me with my breastfeeding and just other little, emotional things that I was struggling with. It was wonderful.
Yeah, and had they not been there, what do you think would have happened?
I mean, I'm sure I would have survived, but I don't know if I would have survived and look how I look now.
Yeah, right, and you look fantastic, so they came in right in time.
Yes.
So why is there such a need for a program like this, especially when it comes to maternal health?
Yes. So the reason that the program was started in 1991, so Healthy Start is a national initiative. There are over 100 Healthy Start programs across the country. And our original focus was reducing the rates of infant mortality, infant death. And what we learned along the way was you can't have a healthy infant without a healthy mom, without a healthy community, without a healthy relational dynamic between mom, dad, partner, or whatever that relationship looks like. So we're still seeing that the societal, environmental factors that our families are living in is contributing to health disparities. And so in Allegheny County, we focus on Black women and babies specifically, with the understanding that our work improves community health for everyone. But the data tells us, as you mentioned in the opening, that Black women and babies are more likely to die from preventable causes. And so that's really the challenge of it, or the thing that is the worst part, is that many of these deaths are preventable.
And I know that this is a problem nationwide.
Absolutely.
But talk about right here in Pittsburgh, because if I do recall, I remember seeing numbers that aren't so good.
Yes.
Yeah.
So what we've learned about right here in Pittsburgh from a report that was published a couple years ago by some scholars from University of Pittsburgh and their colleagues is that Pittsburgh is just not a great place for Black women economically, socially, medically, mental health-wise. So when we think about maternal health and infant health, all of those factors that bring us down, that contribute to our poor health outcomes, are also contributing to poor health outcomes for our babies. So when a woman gets pregnant, all of that stuff that she's dealing with, it doesn't go away, it gets amplified, and it impacts her baby and it impacts her health outcomes.
Okay, and you guys have a big gala coming up next week to really celebrate the people who are pioneering and championing this effort to change things. Tell us really quickly about that gala.
So our gala is coming up next Thursday, September 18th. Registration is still open on our website. It closes Monday at noon. We are featuring Dr. Otey Blackstock. She wrote a book called Legacy, and it is about her journey from her childhood, seeing her mother, who was a medical doctor in Brooklyn, and her situation and how that inspired Dr. Blackstock to take the path that she took, starting her career in medical, in providing medical care, but then transitioning to a focus on health equity.
Yeah.
So there's a lot of alignment with her path, what we see nationally in the data, the work of Healthy Start in Pittsburgh, so we're really excited to have her. Also, September is National Infant Mortality Awareness Month, and sleep-related deaths is one of the highest causes of death of infants, and so we are starting a Safe Sleep Community Task Force to really look at how we can continue to support community in understanding safe sleep and preventing infant death, and all of that information is available on our website.
Okay, well, it sounds like a fantastic program. Thank you both for being here, and I'm so happy that you two linked up and that you found the support that you needed. Thank you both.
Thank you.
All right, well, the Healthy Start Maternal and Child Health Gala is happening next Thursday, September 18th at the Omni William Penn Hotel. We're going to have more information about this event as well as the Healthy Start organization on our website. Well,